Well, I think understanding the impact health sharing and MetaShare, um, we can probably start with that. So impact health sharing, and it's similar to MetaShare programs that are community-based health sharing plans, um, which members share their medical expenses. So how it works is that members pay a monthly share which goes into a collective pool to cover medical expenses for any member in need. And so this is not insurance, but it's a cooperative way to manage healthcare costs. So there are benefits to the church. And, Patrick, you had a really amazing, um, you know, I think, way of presenting it as a cashless donation to the church. And so, number one, it provides financial support without direct donations. So, by participating in these programs or in the Impact Health Share program, members can support the local church financially without making a direct cash donation. And a portion of the monthly shares can be allocated to cover things like church expenses, missions, anything that, even building something in the build, doing some type of construction project. And it also helps manage the budget more effectively by having more cash to do more work within the church. And so I'm going to kind of let Patrick go ahead and touch on some of those points as well with regards to what I just shared, as he's more knowledgeable in this plan and this area as I am.
Well, first of which, I loved what you shared with everybody here today. And first of which, Dr. J, a great way of just talking about the cashless donation. And I know within the ministries right now, a lot of them are looking for opportunities to create revenue. In a very challenging economy. I think, Mark, you hit it on the head earlier. Batting the hatches, right? Don't know if it's 08 and 09, maybe worse, maybe the same. Who knows? But we know there's going to be some challenges going forward. So now we've got a $4 trillion healthcare bucket of money that now a church can offer a healthcare ministry, because Impact is built on a ministry platform, which means no paying for abortion. Some of the things that people that would be aligned with the philosophy of Impact goes really aligned with everybody in the Christian or the church community. Having said all of that, what Impact does so powerfully is they provide major medical for people that need it, but can do it 30, 40, 50, 60, 70% less than what people would pay if they went to a traditional commercial insurance provider. So now we've got an opportunity to save money. So now we've got a community of people that are going to look for ways to save money. As Mark, you talked a little bit about earlier. Great, here's an option that I didn't know existed 3 years ago, right? I didn't know healthcare sharing was an option. Nobody had brought it to my attention. Number two, it's a way for us to give back to these different churches and nonprofits that are in desperate need of creating revenue without having to go back to the members of their church and ask for more money. How would we like to be able to do what's called a cashless donation? What does that mean? Hey, I like Impact for my family. It's been a benefit for me. I was able to save literally almost $2,000 a month going from a commercial insurance plan to Impact Healthcare sharing. So as a customer, I saw significant savings. Imagine if I knew every month a percentage of that went back to what I believed in, where they could do some of the Lord's work, as Dr. J and others that are in that space could repurpose that revenue to do outreaches and other type things that are very important for anybody that is in this community. So one, anybody that has somebody in the church, whether deacon or elder or pastor or minister or anyone at all that's connected to any sort of church type organization, we would love to do a partnership to be able to bring more revenue in, to honor their members, to be in alignment with their philosophies of, hey, we're not going to pay for transgender, or we're not going to pay for abortion, which they've made that very clear. That's not a position that they're going to back down on. But Impact will not pay into those things. So, number one, get a little better product price wise. Number two, knowing that your money is not going to what you don't believe in as a member of a religious organization. And then also knowing that a percentage is going back in the way of an ongoing donation. So, dental and vision will be included in that. So it's a one package deal. Also, we honor people that do naturopathic and other type of doctors, where we can actually give them an opportunity to take some of those expenses off their what we would call deductible or primary responsibility. So hope that gives you a little light on what we're doing here. But I know with your audience, Mark, there's a ton of people that do have those type of connections that could be an easy handoff. Let's honor them. Let's find ways to bring more revenue into them. Before the real challenges come in the economy, I'd like to say, helping them before they're in desperate need of help.
That's awesome, Patrick, what you just shared. And Mark, I wanted to mention that there are great tax benefits to this plan as well. Contributions to the Impact Health Sharing Program may be tax deductible, which will provide financial benefits to everyone that's a part of it. And also the church can also benefit from tax advantages when funds are allocated towards church expenses as well. So it helps basically all over, within that area as well. And one of the beautiful things about the Impact Health Sharing that's different to other health sharing program is the transparency and accountability. So this program, often operates with a high degree of transparency, showing exactly how the funds are used. And so this aligns with, our values of honesty and accountability, and which will kind of ensure members who are part of this program to feel confident in their contributions to this program. I know many of you who are part of a church have heard wonderful messages on stewardship, and this is the epitome of stewardship right here. And also would like for Patrick to just kind of weigh in on that portion of this plan as well.
Yeah, so a great point, Dr. J. So Impact is completely transparent. They show you every dollar that came in, where the money went, whose medical bills were paid. Everything is 3.0. I'd say healthcare sharing brought to the modern version. And also we allow for people that maybe not in a place where they are a Christian, but they're still allowed to come into Impact. So it's not exclusive to just Christian people. As far as Medicare would go, this would be a supplemental. So my mom is a retired school teacher. She needed a supplemental to Medicare. We have no network. The big deal for my mom wasn't the savings, although she saved about $1,100 a year compared to what she was paying. It was the no network part. Unfortunately, if you're with a commercial insurance company, they create a network. So she was forced to see the same doctor, and this doctor was just overwhelmed with patients because they were pushing all their patients to the same doctor, which meant that she couldn't get in when she wanted to. It was a very quick visit because he was so overwhelmed with patients. Where with Impact we have no network. So she was able to get a cardiologist that could spend time with her, answer her questions, make her feel that the decisions as a patient were right because she was able to ask the questions that unfortunately wasn't able to ask because they were moving her so quickly because the doctor was so overwhelmed.
Yeah, that's awesome. So, this plan also lowers health costs for members, on a great scale. In most cases, it's like somewhere around 50 to 70%. Members often find that these programs are affordable and then more affordable than traditional health insurance. And so lowered health costs means more financial freedom for families, and potentially leading to increasing your giving and involvement in church activities as well. So, for example, some people, even young people, I mean, we talked with Zach yesterday, your son, Mark, we spoke with him yesterday. He said he looked at plans before in the past, and especially during the Obama phase, and they were like $500 just for him as an individual under 30. And when looking at this plan, it's somewhere $130, $140. So there's a huge, I mean, that's huge. That's huge, when it comes to the savings that you have in such a plan like this. And there's a beautiful thing about this plan is that if you are a family of three or more, the price stays the same. So if you've got 10 kids, then you pay for three. And the deductible part is what really blows my mind. So if you put a deductible at 2,500, that's not per person. So it's for everybody. So if three people goes to the hospital on the same day, the deductible is not 3 times 3; it's 2,500. I just thought that was amazing.
In the question about it's a reimbursement, no, Impact, gives the member the card. You can see right on the card, WebMD is free. They can call and talk to a doctor real time. All the provider fees, they have what's called an EDI number on the back. So looks, feels, and works just like a traditional, what we would know as insurance. It's exactly the same feel. One, the price is radically less expensive. I was able to save over $2,000 personally a month for my family, which, back to Dr. J, that's more money for, outreach and doing things that I personally believe in. I'd rather give it to my church and other people that, are aligned with what I believe in, but also, putting in a situation where, now we're able to bring revenue into the church and do it in a way that honors the members, makes them aware. And unfortunately, open enrollment's coming. And if everybody thinks their car insurance went up, wait till you see health. Car insurance is going to be cheap compared to what they're going to do with health, unfortunately. And it's not the doctors that are getting rich. They're not the ones benefiting from these massive increases across the board. It's who's between the patient and the doctor. So one, we need some eyeballs on this. This is one of those, hey, I need a nurturing conversation. Where better to have that with people that, have the same alignment as us. Impact will talk to the customer. Impact will educate the customer. Impact will pay for a doula, childbirth at home, chiropractic. I mean, the list goes on of things that they're willing to pay into. But at the same time, I love the concept of what we're doing with Dr. J and other ministers throughout the country, is giving them a vehicle to create revenue and doing it in a way that there's a massive benefit to the consumer themselves, and then a revenue stream back to that nonprofit. So if you're here today and you know people in that space, this would be a beautiful way for us to honor what they do, create revenue so they can focus on the main thing, which is, their outreach or feeding the poor, or whatever it is that their, whatever their mission statement would be, and then be able to create that cashless donation that continues to come in long after the transition is done. We believe this will be the greatest gift given financially to these nonprofits around the United States and Puerto Rico and other places that are desperately looking for, hey, how do I raise revenue without trying to get my congregation to give more? And especially in a down economy, when you're fighting the grocery bill and the gas bill and and the homeowner's bill and the car insurance bill, and oh, by the way, we want you to give a little extra something at the end of the week. A lot of Americans, unfortunately, won't be in a place to do it. So let's figure out how to save them money, give them something that would be in alignment to their beliefs and values. Dr. J couldn't get behind something that did not align with his beliefs and values. Mark Z, for sure, couldn't get behind something. We couldn't pay him enough to say something he doesn't believe, in the sense that, it's truly helping people. And I feel so privileged that we get to take this message to the marketplace. And where better to take it than the nonprofits that are going to need our help and be able to do it in a way in which is giving everybody great value. I've been a customer for over 2.5 years. Unfortunately, my son broke his arm, but what was great is the no network. So I was able to go to a group of parents that we all have the same WhatsApp group. I said, who's the best pediatric orthopedic in the area? Everybody said the same name. And how great was it that I could just walk in, present the card, have my son fully taken care of, all the medical bills taken care of. But when you're in those times of need, and we've all been there, right? How many of us, when that emergency type situation comes up, the last thing any of us want to do is look through a bunch of paperwork to figure out where we can and can't go. And I'm sure everybody's got a story of, hey, wrong place, we're not going to cover that, or right hospital, wrong doctor. So this is extremely exciting. So does this work? The money you save, does it go to the church? No, we will pay the church for bringing customers to Impact. So if the church does sign on, like Dr. J's congregation, if somebody says, hey, I'm looking to learn more about saving money for my family, we'll create a nice little QR code. They'll be able to they'll go to that landing page, talk to Impact, get their questions answered. If they become a customer, we will pay that church or organization monthly a percentage of what that customer spent for as long as they stay on the service. So, for me, for instance, I'm never leaving. So let's call me in the next 50 years, I stay on the product, that church would continue to get paid every single month on that specific program. So that's just to give everybody a little bit of an understanding in what we can do. Yes, so we'll have the dental and vision should be up and running by, I'll say, October. They're shooting for September, but I like to under promise and over deliver. So I tell you October, and if we're pleasantly surprised, it goes without a hitch in September. And that's everything from veneers to orthodontist to teeth cleaning to root canals to anything dental, anything vision. This will all be included as well.
Also, holistic health coverage. Impact Sharing now offers holistic health coverage, which includes alternative treatments such as chiropractic care, acupuncture, and nutritional therapy. And so, you'll have access to a wide range of treatments to maintain your overall well-being as well.
Great point. And look, our goal is to keep the community healthy. If everybody understands the concept, the healthier everybody is, the less all of us have to pay. We want to, move people in that healthy direction. How do we keep somebody healthy so they're not needing to go to the doctor? They're not using the emergency room, as a place to go, get seen. We have 24/7 telehealth. They can see a doctor anytime. But more importantly, to Dr. J's point, is we want them taking vitamins. We want them, going to a naturopathic. We want them to be healthy, because the healthier they are, the better it is for all of us. So great point that you're bringing. I just find this to be completely in alignment with the communities that we're talking to right now. It could not replace Medicare. Medicare would have to be, the primary, if you will. Impact would be secondary. So once you go into the Medicare age, Impact would turn into a supplemental starting at about $96 a month. So just to give everybody a little bit of awareness, I have a family of 4. I pay for my entire family $600 a month with a $2,500 family deductible.
The answer to that question is yes.
The question is, morning, can an individual get paid for setting up a church group? Yes, we would compensate that as well, and would happily do it. I mean, this is really a mission to make a difference, and we are fully committed to helping anyone that does make those introductions. Yes, there is an opportunity there as well. And again, I think you'll see what Dr. J and other pastors and ministers around the country are seeing is we've got to be in alignment right now. And I think right now, unfortunately, if a church doesn't believe in transgender, unfortunately, the insurance companies are paying for it. So, there's a lot of people in the pastoral community that are looking at saying, I can't get behind this because it is fundamentally anti what I believe in. So that's just to give you an understanding of why they're jumping in and wanting to get the word out. They can enroll any time during the year. They can make a change on their anniversary. So let's say I took a very small deductible, or what we call PRA, primary responsibility, like what I'm responsible for. I can change that on my anniversary. So if I want to take a bigger one and pay less, or I want to take a smaller one and pay a little more, that is 100% up to us. And the best drug pricing in America. We don't make money on drugs. We're giving them away at their cost. People are sticker shocked to see how inexpensive pharmaceuticals really are. That's why when we go to Canada and Mexico, we all say, why is it so cheap? Because it is cheap. What isn't cheap is the profiteering from the insurance company and the big pharma working hand in glove. So again, this is all very, very simple for someone to see and understand. And we're fully prepared to give all the collateral material, give people the opportunity to ask any question they want. And so again, if somebody gets, let's say, 100 or people on the product, just to give you an idea, the church would get anywhere between 3,500 and 4,200 a month on just 100 people that signed. If they had 200, they would be over $100,000 a year in an ongoing revenue stream for people that did sign up. So just to give you guys an understanding, I know we're all connected. My church is involved. Dr. J, we just met with a bunch of senior pastors throughout the United States. Very excited about offering this, especially going into open enrollment. Because remember, when people get that 2025 update for healthcare, it's going to be sticker shock. And, nobody should go without health coverage. I don't believe that's an option for anyone, especially if you have kids. You're one accident away from bankruptcy. So this is full protection. This is the, hey, we want to make sure in your time of need, you're fully covered. Medical bills are going to get paid. Focus on healing. Let's not focus on what it's going to cost. Unfortunately, when 2025 comes out, it's going to be very, very painful. Yes, Cleveland Clinic, Mayo Clinic, Johns Hopkins, Northwestern University. I'm in Texas, Texas Health, Scottish Rite. I mean, we've had patients, unfortunately, UPMC in Western Pennsylvania, and the list goes on. Yeah, hospitals, we've got everything up and running on that regard. So again, it makes it very easy is we'll create the, hey, scan this. They go to Impact. They talk to somebody. They can talk about colonoscopies or mammograms or, any of the questions that my family had. My wife is a former vice president of compliance. So I live with a compliance officer. So she read all the guidelines. She had 723 questions. This checked every box. We're now happy customers for the last 2 years. And it is available anywhere in the U.S. So again, from one side of the country, you can see a doctor on traveling vacations. Even we'll pay medical bills outside of the United States in emergency situations. So imagine how many people that are missionaries that unfortunately get sick and they have to fly them back to America because financially they're not in a position to pay those bills, where Impact will pay any emergency situation outside of the United States. Ask them about the BMI. Is that the body mass index? So there is a $125 extra charge if somebody's body mass index is above, and don't quote me on this, Impact would confirm, I believe it's 45%. So if you're 45%, there's an extra $125 a month. If you lose weight, that would be then taken away. So obviously we want to get people healthy. If you smoke, you do have to pay an extra $50 if you vape or smoke or anything along those lines. Again, Impact will talk to the customer, explain this on our behalf. So none of us have to get involved in that. We're just showing people the opportunity and letting them turn around and benefit. Yes, the dental and vision would be available, and it's a very robust plan, and there's many facilities for us to go to throughout the United States.
So one of the things I wanted to mention was that many churches already use what's called MediShare, the MediShare program, and this plan with Impact Health Sharing has better benefits than MediShare. And one of those, of course, is that you can give a cashless donation to your church by getting your church to sign up to the program and also distribute it to their members and to their staff as well. And then also their MediShare is a program where you have to pay the facilities or the hospitals up front and then get reimbursed, which would probably drain a lot of churches' cash. Can you just kind of elaborate on that a little bit, Patrick?
What's unique, and again, just to qualify the question, ask it again so I have a better understanding.
So the MediShare program is a reimbursement program
Yeah,
versus
so in
impact.
the healthcare sharing space, the majority of them are all reimbursement models, and they've worked for 40 years. So there's not a negativity, if you will. What Impact has done is taken a great idea and moved it into the modern world with modern technology and build it with a modern platform and full transparency and being able to go to a doctor of choice and having a EDI number to look and feel like health coverage. What I am so excited about specifically this product is I had never heard of any of these shares. And I go to church, so I don't know what was going on. I must have went to the wrong church, Dr. J. I don't know. I don't want to fire my pastor, but you know what I mean? Like, look, I'm saving $2,000 a month. I don't know why someone didn't tell me, but here's what I realized is because they're nonprofit, they're not good at marketing. Does that make sense? Meaning that's not their job. They're not in the business of getting customers. They're in the business of honoring members and paying medical bills. That's why it needs this grassroots approach of just having people look at. I would have been a customer 10 years ago if somebody would have pointed this out. And you know why nobody pointed it out to me? Nobody got paid to point it out. If somebody got paid to point it out, how many of us would agree? I would have naturally said, oh, look at it. I'm going to make my own decisions, right? I'm not here to blindly do something. I'm going to look at it and make sure it's right for my family and ask the questions that are relevant for my family. But the point that I'm making is how many other people are like me? How many tens of millions of people that go to some sort of organized religion and never knew about this, and we're paying into things that we personally don't necessarily agree with. So I believe this will be the biggest thing for us to help. It's a $4 trillion industry. How much of $4 trillion do we need to make a difference in different churches throughout the world that are listening to the show and they're connected with other people that are in this same situation? So we need you. We need you that are here today to make those connections. There is a 36-month look back when people do have some sort of situation. So Impact will talk to the customer, what's called pre-existing. I really like this person. She's great. She actually is like literally trending further down the road than I was. So give you an example. I had a woman who has an immune disease. Impact's not a fit. She's currently under doctor care. We can't, take her from that and put her on this because we wouldn't pay a medical bill of something that already is dealing with. But let me give you some good news. Her husband and her 3 children were able to go to Impact. So we decoupled the family. We kept mom where she was, right? Let's get mom better. Let's heal mom. But we were able to save the family $8,000 a year by putting the dad and the kids with Impact. So just imagine where now they have an extra $8,000 for vacations or doing the things they love to go do. And they were paying a lot of money. And again, the husband and the children, it was a perfect fit for. So Impact will talk to the customer, go through if it is a fit for them, they'll let them know. If it's not a fit for them, they'll also let them know. And we can do businesses. How many small business owners go to church that said, hey, look, I got 6 or 7 employees. The economy's coming down on me. People are starting to clam up on their spending. I'm trying to keep the doors open. I have to give some sort of medical coverage to my employees. Impact is not just for Christians. So no longer does the employer have to hold his breath because maybe Sally's not a believer. So, you know what I mean? The beautiful part about that is Sally can still come into the share, even though she might not be a believer, but the owner of the business is. Does that make sense? So he can offer it as major medical, not have to worry about, oh, I don't know if they'll let you in because you're not aligned, with us belief-wise. Now we're able to accept those individuals into Impact Health. So think about the small business owner. And when I say small business owner, that's the accountant. That's the roofer. right? How many of us agree that's the heartbeat of our country right now? That under 50 employee is 80% of those employers out in America that are going to be the first to feel the pain of the economy. Walmart will be okay, right? Ford Motor Company will be okay. What is not going to be okay is the dry cleaner, is the roofer, is the woman that has 2 or 3 employees. They have a cleaning service. Maybe they do, all kinds of little things like accounting or payroll that are out there dealing with the explosive cost of health coverage in our country. Again, pre-existing for dental, they'll have a complete list of what that will look like, so we can and nicely, let them talk to a trained professional impact. So the deductible question is great. We do a family deductible, or what we would call a primary responsibility. It can go from $10,000, where you want a big, a primary responsibility with a very inexpensive monthly share, all the way down to 2,500 with a little bigger monthly share. So for me, I'm at 2,500 for my entire family. So all of our medical bills together would then allow for Impact to start paying after we hit $2,500. And the reason I did that personally, my savings was so significant. I said, man, I want to go I'll go to the smallest, that I can, just because I'm saving so much money. So with Real Medical, it hurt them financially to get them left out. So the people with the real medical issues, again, we will put them in a situation where Impact will talk to them. Again, what's great is, you're talking about maybe 12% of society that wouldn't be a fit. And then again, some people get, free healthcare with the government, or maybe they have a job that provides them free healthcare. So this might not be a fit for a number of people, just because of their personal situation. So for the people that it is a fit for, this is going to be really exciting for them. And if it's not a fit, no big deal. Maybe there's a solution. I just had a family where the father had full medical for his kids and his family, because he has a very unique, he works for the airlines, and I guess they have a great program. His daughter turned 27. And what happened is, now that his daughter's 27, she no longer is on the family health coverage. So he did not want his daughter at 27 years old not having any sort of major medical. He was able to sign her up with Impact, $73 a month. So $73 a month. I said, look, your daughter doesn't need a new pair of shoes. She doesn't need, a new handbag. She needs to make sure she's covered medically in case something were to happen.
There are some people that have current medical bills that are just through the roof, and they're probably wondering, what can I join? I've got a bill that's $500,000. Can I join this program, and how can Impact help me? Are you hearing me there, Patrick?
Yeah, I'm reading. Reading the comments. Sorry about that. I feel like like I'm texting and talking. So I got reading. So what was the question?
Yeah. So some people might say, well, I've got medical bills and it's through the roof. I've got a medical bill for $200,000. Can I join this Impact program, and how can it help me?
Yeah, so if it's an existing situation, unfortunately, that's not going to be in our wheelhouse. But moving forward, anything that were to happen, Impact would then be that medical coverage and would take care of any bills and give them any sort of help whatsoever. So Larry, it's not offered in Canada. Canada has free health coverage as a Canadian citizen. But if you live in America and you're a Canadian, maybe you live in Florida, maybe you live in Arizona, maybe you're moving into the lower 50, if you will, they can become a customer. So we will allow for somebody with a Canadian citizenship that's living in America, we will give them full healthcare coverage. Or maybe you're from Mexico working in the United States, you don't have quite the Social Security number, we would also welcome you to the Impact community. So that would be the somebody from Mexico that maybe is working here, they have an ITIN number, they're fully allowed to be a part of the Impact Health.
So Patrick, would Impact be able to help someone get their bill down regardless to fair market value? Is there something that they can do to help?
So if it's a previous bill, that they can't get involved in negotiating that because they weren't technically our customer. So we can't go back and try to negotiate somebody else's situation.
Yep.
But moving forward, we would be able to help. For somebody that just turned 65, the supplemental will be $96. So just to give you an idea, if you just turned 65, supplemental will start at $96. And WebMD included, go to any doctor you want, no network, all those sort of benefits would be immediately applied. No pre-existing for 65 and older on Medicare. So if you're on Medicare and you have a situation, no big deal. We're not going to deny you coverage at that 65 or older. You do have to have Medicare, though. We can't take you without Medicare. Medicare has to be first, and Impact would be then second.
So let's talk about the pastors for a second, and how to, engage the pastors in conversation. Our pastors play a crucial role in guiding our church's decisions and initiatives, and their buy-in to supporting, or just understanding that this program exists and that can help them, is crucial at this point. Because of churches always need funding. I run a church presently, and funding is crucial for every church, because there's so many things that we can do and would like to do to reach the community. So discussing this opportunity with your pastor, I would say, is at a high importance. So how can you approach your pastor? Well, you can schedule a meeting or a casual conversation with your pastor just to introduce the idea of impact health sharing, and they perhaps may already have MediShare, and which would be great. So we're not asking you to become an expert on impact health sharing, but we're asking you to share your personal interest and the potential benefits that you see for the church, and also provide them with the contact details for Mark's team. He's got a really great team with Zach and Jeremy, and all of those details should be provided. I think it might be in the post, but he will provide all of those details as to who they can schedule a Zoom call with, our Zoom calls are really, really powerful, because these Zoom calls can, answer most of the questions that these pastors would have. But definitely, I think if you make the introduction, we will be able to see they will be able to see the benefit of the program.
So I love what you're saying. And also, Pastor Jay will be in on those. He'll explain how he's created a healthcare ministry, how he's able to bring that into his church, and how he's able to help staff members and others that do need healthcare coverage, as well as they are full-time people in ministry that unfortunately are struggling to get affordable health coverage, and again taxing the community because they have to pay $1,800, $2,200, whatever that might look like. So the midwife question, I love this one. First of which, we honor midwives, we honor doulas. We will pay into that. So I'd love to talk to you in your community. I know that's something that we've had great success with. The what you pay goes according to your age. So her question is, if I have a family of 4, you pay $789. So again, that would determine by the oldest person applying. So I'm over the age of 50. I pay $628 for my family of 4. It's $628 a month with a $2,500 primary responsibility amount. Now, there is a 10% copay, or what we would know as a co-share, that Impact will pay 90% of every medical bill, but that 10% has a cutoff at $5,000. So what does that mean? If it's an organ transplant, if it's a NIC unit, if it's airlift off the side of a mountain that somebody needs, emergency care, there is a 90% Impact will pay. you, the customer, would pay 10%, but that 10% has a limit. So there's not going to be a continued 10%. It's so max out of pocket would be $7,500. The $2,500 primary responsibility, max out of pocket would be $5,000 on the copay. So just to make everybody fully aware, and again, Impact will talk to them, Impact will explain it to them. I had a nurse that does IV drips, and she beat cancer 10 years ago. So she started an IV drip company because that's one of the reasons she was able to become healthy. Well, unfortunately, she was paying $1,300 a month with her provider. I showed her Impact. She said, hey, I beat cancer years ago. Praise God, she's cancer free. Great. She went to $268. So immediately she saved $12,000. The second thing that was a big deal for her, when she was fighting cancer, she had a copay that was never ending. So she was like, look, I was getting bills in the mail, 5,000, 10,000, 4,000, 3,000, because her copay with her previous company was a 90-10 split that never ended, right? She had to pay the 10%. We have what's called a cutoff where it would be max out of pocket $5,000. So some amazing questions, but I hope you catch the vision of how we can connect up people that are doing good work. And I think that's the part where we have to really stand on. Before the rain comes, we got to build the ark. Before things get very difficult, because people are going to go to these different church organizations to help them pay their electric bill, to help them make a mortgage payment. I know, Dr. J, you've done that. And I know that's part of, the beautiful part of a community to help brothers and sisters of like-minded faith. Unfortunately, if there's no money to pay out, when they do come with my husband just lost his job and we need a couple bucks to make it till the end of the month, churches by nature want to give any way they can, but they can only give what they have. So imagine if we had a way of being able to create another revenue. We're not asking people to pay more money. We're not asking people to reach deeper into their pocket, but give them a stream of money that they can go do the Lord's work with. And I believe now more than ever, there's different people in the church community that see the value of directing the spending to things we believe in. I think there's too many people behind the pulpit that are upset about, hey, we're funding what we don't believe in, right? If you don't believe in something, it's sort of hard to keep paying into something that in the end isn't aligned with your values. And I know, Dr. J, that's been a big deal for you, because obviously that, abortion isn't something that you would want to pay into or share into, or, hey, I don't want to pay for transgender or things along those lines. So again, this becomes extremely exciting. So,
so we even have, we went the extra step as well, Patrick. Under the same company's umbrella, we got Zoom Energy, and so we decided that we're going to put we got the phone service for our church, we got the Zoom Energy for our church, and we decided to bring everything under this umbrella, just to make sure that just to take the benefit of that, we know where our money is going. We know the companies, corporations, or organizations are where our money is going. And so I think that's something that we should, kind of look at as, and take it more seriously, especially in these days. During this election cycle, it's getting pretty wild out there. And more people are beginning to realize and understand how bad it is, especially with the Olympics that just happened in France, and how much they don't care about our side. They don't care about Christianity. Our world is getting worse, and we've got to throw our support. We got to put our money where our mouth is, and say, you know what, wherever we can support and be, Christian organizations that we believe in, we've got to put our money where our mouth is. And I think this is one of those opportunities where we do that. And I'm doing it as a church. We are doing it, and so I encourage every one of you to do the same. Put your money where your mouth is. If you believe in Jesus Christ, you believe in, and you are a conservative minded individual, and your family is conservative, put your money where your mouth is. That's what I'm pushing you to do today.
Love this conversation. I believe we can do something great. I think the audience, Mark, of you and the others that that have these type of connections. I mean, I think we all would have loved to help the Pastor J's, the Dr. J's, and other people create more revenue. And here's a great example of somebody that's embraced this, that's loving this, is bringing it to other ministers and other evangelists and other people that do represent individuals that are looking for some choices that they might not be aware of.
To me, this one is neat because so many small churches, especially, are strapped, and economically, I mean, you saw it in 2008 and 9. We saw a record number of small churches closing their doors for good. Creates an opportunity to really help them keep their doors open. Bigger churches helps them to, increase their ministry, the size of it, the scope of it, to help more people, be there for more people. It has tremendous potential.
Yeah, you're spot on. And Mark, I mean, you've got a big reach. Anyone that has any sort of nonprofit could. I mean, I've signed up the Texas Chiropractic Association and other associations, so we can navigate these waters to anybody that's bringing value to their audience. This is another bolt-on opportunity to create revenue and just bring market awareness, because it does need market awareness. This is something that I would have not picked up if Facebook would have put an ad out or somebody would have put a billboard on the side of the road. I would have never looked twice, just because the savings were so significant. I wouldn't expected that to be able to take care of my family. I would have said that's supplemental, or that's just for poor people. You know what I mean? I have a business. I'm a normal, individual in society. I don't believe I could get health care benefits at that reduced cost.
Oh boy, I think they're going to be busy on the phones answering those today.
Yeah. And I just love what we're doing. I know the ripple effect that's going to come from this. And the people that, again, in a down economy, when their time and need is there, I would love to have churches be the ones to give them
Lead.
what they need. I don't want them to look to the government. I don't want them to worship, hey, the government was there when I needed them. I want them to go to their place of worship and let that be the house, the storage house, with the resources to be able to make it through those dark times, and know that there's a community of people around them, and let us be one channel of funding outside of what they're already doing, and do it in a way that honors everybody. It is in complete alignment with what they specifically believe. So I love what we're doing. I thank you, Mark, and your generous time and bringing us on. And I love, hey, look, give the phone number a call. Let's see what we can do. Let's connect the right people together. Let's make a difference. I live in abundance. It has to be a win-win. I believe that's the only way we're going to make a real difference in the world today, is to be able to create revenue for organizations that we all can get behind and stand behind. And this is just a $4 trillion industry. So we don't need a lot of $4 trillion to make a big difference. I mean, we're not talking the billions, we're talking the trillions. And it's just a special time to be alive, to be able to make that difference.